Good morning. My name is Oliver Hendricks. I'm a professor in rheumatology. I'm working at the Danish Hospital for Rheumatic Diseases in Sønderborg, Denmark. And today I will present the results of our study. And the name of the study is DECODIR. We actually have been performing these investigations concerning the reaction on the Danish COVID vaccinations on the very core of our patient population, which means RA patients, SPA patients, and PSA patients. Very briefly, in the beginning of the pandemic, there was a relevant and serious concern if patients with these inflammatory rheumatic diseases respond like the background population, as we know that patients with rheumatic inflammatory diseases have a compromised autoimmunity, which is sharpened by the main compounds given in these situations, which means conventional DMARDs, biologic DMARDs, and prednisolone. What we did, and this is due to an advantage in our house as we have a related lab to our outpatient clinic, we invited our patients to join this study by taking baseline blood samples, which means blood samples that were taken at the time point of the first vaccination or not more than 4 days after the first vaccination. And then we took the next blood sample 6 weeks later, and then again half a year later and a year later. We could include 244 patients, and we have the follow-up blood sample material on 227 patients. And we could show that after half a year, when the first and second vaccination had been performed, there was a very low antibody response in those patients who simultaneously received both CS DMARDs, conventional DMARDs, and biologics, and also in the group with prednisolone treatment when compared to those patients who had been in a good treatment scenario, i.e. patients who did not receive any active treatment. This was our control group. So in other words, after half a year and after receiving 2 vaccinations, there was a very low response in those treatment groups when compared to the patients who did not receive any pharmacological treatment. And after 1 year, which means after the booster vaccination was performed for all of these patients, we could announce that the response in terms of antibodies against COVID was significantly higher in all groups. So the main conclusion of our study is get the booster vaccination when you have inflammatory autoimmune rheumatic diseases. And we can argue that while not achieving a good response after being vaccinated twice, you get a much better vaccination response after the 3rd booster vaccination. And that accounts for all treatment scenario, which means also the treatment scenarios covering prednisolone or the combination of conventional DMARDs and biologics. That is the main conclusion of our study. And even though now being in Milano in the nicest weather and in summertime, COVID seems to appear very far away. Incidence rates for COVID are low, but we will once again face a situation where we have to be aware that COVID is not over. So we have to be aware of the fact that we will enter the autumn period and we will again be confronted with the questions, should I be vaccinated or not? And based on our data, we will suggest that our patients with inflammatory rheumatic diseases should get a booster vaccine on a yearly basis. This is the very extract of our data. Thank you very much.